Hi, I'm Katy Salt. I'm a speech and language therapist here at the Royal Surrey County Hospital in Guildford, Surrey, England. I initially trained as a professional actress back in the 1980s and worked professionally for 10 years, mainly in theatre. And then I retrained as a speech and language therapist in 2001, and I've worked here ever since. I've been lucky enough to be trained in both performance and speech and language therapy. And I'm lucky enough to bring together my knowledge from both disciplines, which has helped me hugely in my clinical work and also helping professional actors and performers. In my column, I want to highlight the vocal problems that you might be experiencing as performers and singers. I want to look at vocal care, anatomy and physiology of the voice, so you know what's going on and how it's happening. Vocal release of constriction to help you relax the larynx. Breathing, making sure that you're breathing correctly and supporting your voice in the right manner. Vocal misuse and abuse, so things that you might be doing that might be causing problems with the voice, that it's actually aggressive to do, but you might not know. Nodules and laryngitis. A lot of people are very frightened when they go to a specialist and they find out that they have nodules. And I just want to talk you through that. And also the pathway that you take if you do have anything wrong. Going to your GP, getting referred to ear, nose and throat, ENT department, and then to myself, a speech and language therapist or speech and language pathologist. But I don't want to just talk to you about voice. I want this to be interactive. So I want you to be able to send your questions to me for me to answer during these sessions. So if you'd like to email me, then just find the email address at the bottom of the page. Questions about the problems that you're getting, hoarseness, you might find that your vocal quality has deteriorated. Just briefly outline your problem and we'll go from there, and hopefully I can help. I'm often asked by performers and singers, how do I look after my voice? What do I need to do to keep it in good shape? Well, I'll tell you, the negative things first. Don't smoke. Smoking causes dryness of the vocal folds and is also an irritant. Spirits and alcohol. Some people like to have a little drop of something to give them a bit of courage before they go on stage. Don't. It's very dehydrating. The next thing is environment. And because as a performer, you're moving around from different environments, you might be working in dusty, dry environments, also perhaps smoky environments. And that's all going to have an impact on how your voice behaves during performance and at rehearsals, and how it's affected afterwards as well. The next thing is caffeine. Try not to drink too much caffeine. Like alcohol, it's drying. Caffeine is a diuretic, so the water tends to go straight through you and you don't absorb it. The next thing is very hot, very dry and spicy foods. And people often say to me, why? Well, with hot liquids, it can strip the mucosa, so it tends to leave a very dry oral tract. Very cold can constrict the laryngeal muscles, so you don't want that before you go on to do a show. And spicy foods, well, that can cause acid reflux or laryngopharyngeal reflux. We don't want that because that can cause problems with the vocal folds as well, so it's best to avoid it. Also, the time when you're eating. Reflux is an important issue. I'll come on to that in another stage, I think, but it's something that can damage the vocal folds quite considerably. So if you do get any indigestion, then it's best to get it checked out. Go to your GP and get some medication to stop it. Also look at your eating. Are you eating regularly? Are you eating late at night? because honestly you should be eating at least 3 hours before you go to bed. So after show party and things like that, relaxing after a show, you're going out, you're eating, and then you stumble back into bed. That's not really a great idea. But you know, look at your lifestyle. The next thing is something called hard glottal attack. As a singer, you might well have heard of it, and as a performer, you should know about it if you've been classically trained. It's when the vocal folds come together in a hard manner. Any, only, always, for example. And it's best to reduce that as much as possible. It's quite aggressive for the vocal folds, particularly if you're using it and you're projecting as well. The next thing, which is interesting, and a lot of people say to me, oh, that's really, is whispering. If you do have a cold or you have an episode of laryngitis, don't whisper. You think you're doing good by whispering and saying, okay, I'm conserving my voice, but actually you're tightening these suprahyoid muscles and causing laryngeal constriction. The next thing is anxiety and tension. We all have tension and anxiety in our lives, but some of us deal with it in different ways. Some of us push it down inside us, and some of us express it. Just be aware of it, because it affects the way that our larynx behaves, and it affects the tension levels of the laryngeal musculature. Sometimes internalization of emotions can also lead to acid reflux. So it's always worth to make sure that you're in a relaxed manner. I know performing's hardly relaxed, and just before you go on stage, your heart's going to be pounding. Try and relax, try and get some relaxation, maybe a full relaxation CD, or think about your breathing, getting your breathing right down into your abdominals. You should be doing that anyway. The best things to do is hydration. At least 2 litres of water a day. And that's going to keep everything hydrated. Some people say, oh, I didn't think it went over the vocal folds. And it's not about where it's going, because it's actually going into your stomach, but it's about what happens to it within your body. It hydrates you. It doesn't just hydrate your vocal folds, it hydrates the whole of you, and that's what you want. Also, regular steam inhalations. It's an old classic, but it works. But don't do it just before you go on stage. It needs to be an hour or so before, because otherwise those capillaries are open, they're enlarged, and you don't want them to be enlarged when you go on stage. But facial steaming is extremely good. Also, hydration of your environment. Some people like humidifiers. Other people, they'll put a towel or something on the radiator just to encourage a bit of humidity within their environment. So those are just a few things to be thinking about regarding vocal care, the do's and don'ts, and what's good and what's not so good. I'm looking forward to helping you with your vocal health and also helping you with your vocal journey. Don't forget to email me at the bottom of the page. I look forward to hearing from you.